right, guys, so today we're going to talk about price control in the pharmaceutical industry. So, what is the problem? There has been a significant increase in the cost of prescription drugs in the United States, and a lot of this is beyond what the average American can afford. As you can see, even just 30 years ago, we didn't even reach $100 billion spent on prescription drugs, whereas today we're spending between $300 to $400 billion on prescription drug costs. So the reason that this is an issue is mainly because we need to be able to keep up with the health of our citizens in the United States, and people are dying. There is about 45,000 people every year that die due to lack of accessibility to healthcare and medication. And then also there is a lot of people who are not taking their medications. So while people can go to the doctor and get their prescriptions refilled, a lot of the time they won't purchase them or go to the pharmacy and pick them up just because they aren't even able to afford it. So people aren't even able to take them. Also, we're being taken advantage of. There has been shown that there's no correlation between the cost of what prescription drugs are and how much we're spending on it as compared to how much they cost to produce. So they're charging us a whole lot more than we actually need to be spending on these prescription medications. It's also a problem because of the increased socioeconomic gap. This is going to mean that there's a huge difference between the wealthy and the poor in our country. So while the really rich is able to afford with ease the medications, people who are in poverty or who are slightly less wealthy, even just average Americans, it is much more difficult for them to afford these basic needs. So why is this happening? There are many reasons why this is happening. First of all, the United States doesn't have universal health insurance. So there are a lot of countries in Europe, Canada, that offer universal health insurance. So every single citizen is guaranteed health insurance and guaranteed coverage. So a lot of the times, whenever you go to the doctor, you only have to pay a copay and your health insurance covers the rest. Same thing for picking up prescription medication. So say your prescribed medication is $500, your insurance will pay $450 of it, and maybe you'll be responsible for the $50 copay. Well, without that universal health insurance coverage, a lot of Americans are completely responsible for the full payment of these prescription medications, and with how expensive they aren't even able to afford it. Another reason this is happening is because the United States has free market policies and we protect monopolies. So there are no price ceilings. There is no cap to how much that the pharmaceutical industries can charge on specific medication. They're able to, if they wanted to, sell a drug for $1,000, $2,000, even if it's something that's required and necessary for people to survive. And then another big thing is going to be brand name exclusivity. So after a innovator creates a medication, they have 5 to 7 years where, as incentive for creating that medication, they are able to be the only ones who can produce and sell that medication. So a lot of the times you know about brand names and you know about generic names. So brand names are going to be the companies that first produced it, and then generic names are going to be the ones that produce it after it's come out. Brand names are given 5 to 7 years after it first comes out through the FDA, that they are the only ones that are able to sell it, and that basically means that they can sell it at whatever price they want. There's nobody else who's going to give a more affordable price, and so people who need that medication to survive have to pay that full price, that really expensive price. And a lot of the times that's also above what the average American can afford. If you can see here, Consumer Price Index, so this is going to be about the average of what people are willing to spend, are able to spend. This is what the brand name prescription costs are going to be around. all the way up to here, and you can see it's rising past 2015. We're in 2019, and then this is just going to be the generic prescription prices. So as you can see, that's much lower. So how this can be solved, there's two overall strategies that I believe that we can implement to help solve this problem. So first of all, it's going to be increased government involvement in the market. So this is going to have specific ways that the government is more involved in setting these price caps and making sure that these prices are lowered, because pharmaceutical industry is not doing a good enough job currently at doing that. And funding needs to be reallocated towards pharmaceutical access. So a lot of that is going to be through increasing the health insurance that is available to Americans. And as you can see, this is what the United States is currently spending on health insurance, and this is compared to the G7. So these are going to be countries that are economically equivalent to the United States. They're all industrialized nations, and they're going to be comparable when looking at the economy. And as you can see, the United States is spending a whole lot less. So more specifically, how this can be solved is expanding social welfare. So a lot of people know about the Affordable Care Act, and that is basically just having all Americans, this is just another form of universal health care for the United States that was implemented. Expanding that would be important because that would allow for more Americans to be covered. And whenever they are covered, they're able to get those costs reduced and more paid by the medical insurance companies. And then more specifically, also, there needs to be negotiations between the government and the manufacturers. So these 3 points right here are actually things that are implemented in the countries that were in the European Union, and that is how they keep their drug prices so low. So whenever there is a negotiation between the government and a manufacturer, say that a manufacturer wants to sell a drug for $500 and the government says, no, like, we think that $200 is reasonable. They'll sit down and they'll have specific boards be negotiating till they get to a reasonable price where the manufacturer can profit and the government shows that it is affordable for their country's citizens. Also, price ceilings are important because that is just going to be the maximum price that is allowed to be sold for those prescription drugs, and then reference pricing. So that's going to be giving you how much that the citizen of the country, so in the United States, Americans would be willing to spend on that specific drug, and that's going to be how much they're both willing and able to spend. So that's just going to give the country and the manufacturers a better idea of how to increase affordability and accessibility of their drugs. So what will be the result? I just used this little graph because Canada has a really great example of a health insurance or a healthcare system that allows for their citizens all to be treated. They have really great rates of people who are covered. They have a system that the United States could very well implement. And then ultimately this results in a really, really big difference between the prices that the citizens are spending on these necessary drugs. So you can see, like, this is used to treat multiple sclerosis, leukemia, Parkinson's. All of these prices are much lower, and these are things that these citizens need. And they're spending in Canada a lot of the times less than half of what Americans are spending. And this is because Canada is implementing those policies that previously have been stated. So going back to negotiations, reference pricing, universal health care, things like that. So in result, we'll just have a better overall quality of life for Americans, and just healthier, longer lives, better for producing, better for working, everything like that. And then here are my references.